you for taking us.
Thank
a slightly
you.
longer drive down here than we
It's
expected.
beautiful.
So obviously I know you and know your history, but let's I always like to start by just kind of getting an idea of who Imogen is, your background, what brought you to Cayman and all of that.
Great.
Before we start.
Yeah,
so,
perfect.
Who is Imogen?
Good question. It changes. It changes. I guess the short summary is I'm a dentist by trade, but I haven't done dentistry for the last, it's coming on 5 years now. Yeah, I'm not sure I'd remember now. I think I just about would. But yes, I started off in dentistry, very quickly went into the aesthetics industry, and this was back in 2014. And then since then, I've had businesses in the UK. I've got a Ventus here now. And gradually over that time period, the aesthetics became more and more a feature of me, my skills, the business, until now it's the only thing.
All of that. When did you come to Cayman?
I've been here nearly 9 years now.
Okay, yeah, I was thinking, because I feel like it's like forever since I've known you.
Yeah.
And so when you actually first came to Cayman, you were doing dentistry, obviously. But
Yes.
You did have White Swan.
Did have White Swan, and I did do aesthetics here. So in the particular clinic I was in, they weren't doing any aesthetics, and so I kind of kick-started the aesthetics in that clinic, and sort of started to build up the client base from there.
Because when I think of back then, that you were so far ahead of the curve, because...
Oh, thank you.
No, but you were, right? That's 9 years ago.
Yeah.
The aesthetics industry here wasn't where it was.
Yeah.
And, obviously I did my research. And now it's... So just to kind of dig a little bit more about dentistry and aesthetics, that's mainly what I want to speak about you today is, first of all, the innovation involved in, because you were so far ahead. But just how, when I did my research, how many dentists have transitioned into aesthetics, and to kind of like ask a little bit more about why you think that was, and then your story, obviously. But what I found interesting when I was doing the research was how they explained it as, you would go to a dentist to fix things. You'd have a pain, or so it was very much a medical, like you go to the doctor, you go to the dentist because there's something wrong. But now it's shifted into, actually, people are going to dentists for so much more than that. Now it's like, how do we enhance?
Yeah. And that is for actual dentistry as well as aesthetics. And I think there is also a big divide, because the UK, I would say the majority of practitioners or aesthetic practitioners that are doing this are dentists. There are still a lot of doctors, but it's heavily weighted towards the dental community. In the US, it's different. So it's dermatologists really that have cornered that aesthetics market. So I think sometimes people from the US or who've lived there find it quite unusual that a dentist would be doing aesthetics.
So it's very much more kind of the...
Yeah.
Why do you think that is?
So I'm not entirely sure why it's developed kind of countrywide like that. I think the dental community in England was very, very focused towards the aesthetics market, because they understood...
I was going to make a joke. I was like, why? Because we have really bad teeth. We're having bad teeth in the UK.
We do, and some of it's true. Well, compared to the US, but they have their own problems. They have their own tombstone issues going on. So we all have our problems. But yeah, so I think there was a very, very big emphasis on the fact that there was a huge crossover in skill set between a dentist and what you would need to do aesthetics. The manual dexterity, the anatomy knowledge of the head and neck, the injection skills, all of those kinds of things.
Because you understand the face, the facial muscles around that.
So I think they easily transitioned into doing that because there was such a good crossover in skill set.
Why do you think the industry, because when I read up, it was like it's expected, the medical aesthetic industry is expected to hit $40 billion in the next 2 years. Why do you think, where that growth has come from? Or what do you think is driving that growth?
I mean, humans have always had the desire. You might think that there's this specific type of person that does aesthetics. That's just not true, and that's not who comes through the door. Both in the clinics in England and at Aventis, you will have everybody from builders in hard hats to Instagram influencers to maybe someone who's just got divorced that wants a little bit of like a touch up, to the sort of 80-year-old lady who's never done it before.
Oh my gosh, that's literally my mum. All of a sudden she decided, she was like, what do I need? And like
what?
You're 70. Relax.
Yeah.
You're fine at this
But
point.
it's never too late, really, honestly. And so I think the driving force behind all of these types of people is whether we have access or not, or whether we admit it or not, there is that innate want to feel and look our best, to have that confidence boost, whether you're male, female, whatever it is.
I must say, because I mean, I kind of knew that from some of my friends.
Yeah.
But I actually love, and I'm in full support that men are now getting all of the treatments too, because one, why should we have all the pressure on us?
Yes.
Like, we want you to look better too. But I think, do you think like the stigma's kind of...
The stigma is lessening, and actually I would say that that's happening quite quickly in Cayman. When I first came here, it was definitely more hush-hush, and people are opening up about the types of treatments they're doing, not completely, but as that stigma is lifting, and the emphasis for men here to look quite fresh, we look quite good as a community in Cayman.
Yeah.
And so I think there's that added little bit of pressure. And so I think both of those things combined means that a wider variety of people are seeking these treatments here.
I guess it's more accessible now too, right? Because there's so many places offering it now.
Yeah,
Whereas,
definitely.
I don't know, 10 years ago, or maybe longer than, 10 years ago
even,
that when you first came here, I obviously went to you, but there was not that many people around. So
very few.
A lot more, it's a lot more accessible.
Yeah.
Interesting. So for you, obviously you came to Cayman, but you still kept White Swan in the UK. And we were speaking obviously before we started rolling about one of the things that I've struggled with in the UK, in like my industry, is inspiration and training and education. So I obviously have to leave quite often. And I asked you the same thing. How do you, in your industry, I just feel like there's always something new.
It's very fast paced.
Stay on top of the game and, relevant in the market that's growing so fast.
And White Swan's really helped with that, because we've got 7 doctors, 5 different clinics. 5 different clinics. And that community that we meet regularly. We're on WhatsApp all the time. We have a little WhatsApp group. And we also go to conferences together. So we go to the ACE conference, which is this big aesthetic conference in London every year in March. And we meet up at those conferences and we debrief about the different lectures and things. So it's not just about attending these types of events. It's, do you have the community to be able to bounce ideas off, to enhance that creativity, and also for different people's experiences, because you have to do quite a deep research into these types of treatments and products before introducing them. And then it also comes down to, what are the other doctors experiencing? What's happening in their hands, not just what's happening in these clinical studies. So it's blending all of that together. The other thing I do is quite a lot of online stuff. So I always try and do at least one anatomy training a year, because people forget. Yes, all the artistry is important, but at the heart of this is safety. And how can you possibly, it's like CPR, if you're not doing something like that once a year, you forget the intricacies of it. So I'm just doing one at the moment where you get sent this skull, and then you get sent all this plasticine, and you watch the videos and you build this whole human face with all the muscles and the vessels and everything to the video. Right. And so you actually can see how, and you can take the skull apart and see how it all interacts. And something like that is so useful to then...
That is why, we'll talk about this later on, that's why I would never, ever trust just anybody to stick a needle in my face. Like, this is why I come to you, or come to other people, because even just, so you saying that from us, and you know more than me, nowadays there's so many people doing aesthetics. We'll call yours medical aesthetics, but there's so many people doing aesthetics, and it's scary and crazy to think that they probably don't do any of this, right? Because you're choosing to do this.
Absolutely.
And I'm sure for your team as well.
And also the other factor is that even as a dentist, the anatomy knowledge will be there, but there's very specific anatomy that you need to know for doing these specific procedures. So it's also tailoring that. So this was a skull course specifically for medical aesthetics. So it would say, okay, you'll be injecting in this region, so these vessels will be particularly important. So it's not just, okay, this is what I'm looking at. It's how does that become relevant to the day-to-day practice that I'm doing? So it's all of those types of things that you can't just rely on, any doctor can't just rely on that anatomical basis. You've got to be evolving as products evolve, as techniques evolve, to make sure that you're safe.
Let's talk a little bit more about, because I know I've said this to you, like, oh my gosh, there's so many things, especially going back to why the market's grown so much, social media, obviously.
Yeah.
There's so many influencers, so many different things out there. And as a consumer, it can be overwhelming. So, I remember coming to you one day and I was like, I just need a calendar for the year of what I need when, so I can, one, budget for it. And then two, just so I really know what I need, not what, because
TikTok
what
says.
I need is not what Joe Blocks needs. So, with all of let me go back a little bit more. With all of the different things out there, how do you decide we're going to offer this at Aventus? What for you is like the kind of criteria, because there's so much?
So I think it becomes much more simple when you think about things in categories. So for example, I would say this year, the big treatments have been polynucleotides and exosomes. Those have been the big things that have kind of hit the market. But they go in the category of regenerative treatments. So in your group of regenerative treatments, you would have everything from microneedling to PRP, lasers. You would have polynucleotides, Profilo, skin boosters. So there's a huge, so then it starts to become confusing. But then if you understand, okay, I want to do something regularly in a regenerative capacity for the skin, for the lines, for the wrinkles, etc. And then from that, you can decide, okay, but what are the key goals? Is it more of a full face approach I want to do? Are there specific target areas? What level of regeneration? Is it surface? Is it more collagen building? And from that, you almost whittle down, with your practitioners kind of, I would be guiding you. You then whittle down from that which treatments might be great for the patient in front of you. But similarly, when you're thinking about, okay, what would work well in my clinic, you come back to those categories of things that you have and you think, how are these treatments going to blend in? What's missing? What can I not offer? What's missing? So for example, I've been feeling for a long time that the surgical eyelids are something that we're missing. I'm like, you know what, we can pretty much treat...
Is it because I asked you?
You and the rest of the islands. But, I'm thinking we have non-surgical options for pretty much anything else.
But
that is our nemesis. So that is a big gap in our clinic at the moment, which is why we've got our 2 oculoplastics on the way, because that's not something that we can do currently.
So you obviously, you offer all of the things, but then if you find that there's a common thing that people keep saying, this is a problem area, and then you're looking at, okay, well, I don't have that. So then you look at the market and you go to the conferences and then it comes down to, okay, well, there's a demand for that. Yes, it's just like anything, you're meeting the demand.
And then you can also, I think lasers is a difficult one because people get confused. There's so many different names for lasers, but a lot of them are brand names. And if you're not thinking about the technologies, like, is this a resurfacing laser or a fractional laser? Is this a light therapy laser? Is this a hair removal laser? Whatever it is, people will come in and say, do you have the Clear and Brilliant? Do you have these are all brand names for the same technologies. So again, if you were thinking, well, what new laser do I want to introduce in my practice, you would look at the technologies and the wavelengths that you have, and you would think, what's the gap here? And then you would go to, well, what's the best quality machine I can get? And you would do the research from there once you identified what technology is required.
Do you, it's so funny that you said about laser, because the amount of times I've said to people, we just had the day Lou's like, oh, we'll do a beach day. And I was like, I can't have a laser. And then we talk about this, and then, but people think it's like hair removal laser on your face.
how hairy are you? Oh dear.
But I guess just with that being said, just to say that, although there's a lot of information out there, there's not a lot of education.
Yeah.
So when you say laser to someone, there's so many different lasers.
So many different lasers. And so much confusion.
I feel like I'm like the perfect consumer that I'm just like, you tell me what
Yeah,
I need.
yeah.
But do you ever get people that, they come in with, they may have watched TikTok, or they have an expectation, they come in and they know what they want, and you are like, absolutely not, that's not what you need. What happens in those situations? Or they come in and say, for example, I want filler, and I want, I don't know what you call it, like a full face of filler, and I want my lips, and I want this. How would you handle that situation?
So, first part of that question is really, you have to remember that people have different aesthetic visions, and that's okay. Right. So I don't dictate based on just my own aesthetic preferences. If somebody wanted a vision for their face that wasn't necessarily what I had in mind, it doesn't mean that we can't talk through options, or I could educate them, perhaps this particular treatment might not look the most natural, etc., etc. But it's not about me sort of dictating how they should look. Right. However, what I try and do is I try and start off in the consultation. They come in and say what they want. I'll try and start off in the consultation, and I'll explore why. And I'll explore, what is it? Okay, you want this full face of filler. What is it you're looking for? Are you looking to be more lifted? Are you looking for your skin to be better quality? Find out what the problems are and really delve into that, because there may be a disconnect between what they're asking for and actually what they're trying to achieve. And they may not realize that. And then I usually seat them down and I'll do the 3D camera. And the 3D camera will show the different levels of the skin. It will show sun damage, rosacea, acne breakouts. It will show different angles of the face. So you can actually measure the golden proportion of someone's face. You can do the thirds. You can do the width of the cheekbones, the width of the angle of the mandible. So you can do all of this. And then you can say to them, okay, if what you're trying to achieve is lifting, and I hear you, and I'm with you on that, but let's look at this and let's take this kind of scientific approach. This is how we're going to get there. Okay. And so that way you're not really suddenly telling someone, no, you can't have that, or that's not a good idea. You're getting on board with their vision, but then you're also helping them achieve it. Right. And that normally works.
Yeah?
Yeah.
I guess it depends. I feel like the type of person that will come to you is probably a bit more open to having those conversations.
Yeah.
I guess where I was going with this, because in the UK, the UK is good. There's some good, great clinics and some not so great. But whenever I go back, I notice how young people are. And I have like relatives who are, 20 and they've had their lips done and all of these things. And again, as you said, personal preference. But I'm just like, who is doing this to their face?
Yeah.
Who is allowing them to do this? Because they do not need half the stuff that they've done. And I guess, like any industry, it has become a little bit of, it's a moneymaker too, and there's not so good or so ethical practitioners out there too.
That is a problem, and I think, but I think that's a problem everywhere, that people want to do this as an addition to their main practice. Yes, because it's fun, but because it boosts their income. There's nothing wrong with that, but that can't be the primary focus. It's got to be the secondary focus, and it can't be a sideline. You've got to, if you're doing 1 or 2 cases a week and you're doing your existing job, it's not a focus for you, and maybe you don't put that time and energy into delivering the absolute best care that you possibly can for that patient, and maybe that shift just needs to change a little bit between spending that extra time with the patient to make sure that you are having that holistic approach, rather than someone coming in, you've just done this, you've just done another patient, whatever, and they come in, I'll have a bit of Botox, okay, lie back, cool, done. It's very different.
Is that why you decided to go full time into aesthetics?
And there's nothing wrong with splitting your...
A lot of dentists will still do that.
Yeah, and there's nothing wrong with that as long as you've got the time and energy and love for it to dedicate enough to it. It can't be the poor relation. It's got to, it deserves respect. It's got to have its own time.
I say it all the time, but I'm going to say it again. The fact that people allow anyone to stick anything into your face blows my mind. I'm like, I'm going to ask all of the questions before I let you anywhere near me. Especially some of the, laser.
Yeah.
Just because I just went through it 2 weeks ago.
Yeah.
I mean,
it's
if
hardcore.
I didn't trust you,
yeah.
I mean, Sina is obviously
yeah.
She's amazing, but it's because she's under your umbrella guidance. But I'm like, you really have to trust someone that's burning your face off.
Yeah. When you can smell your own face.
I call my mum's the complete opposite, right? So she's never had any kind of treatment other than a facial. And I'll call her FaceTime and she's like, oh my gosh.
Oh, gosh. You're like, wait for a week.
Wait, just give me 5 days.
The glow's coming.
The halo's coming, right? But you really do have to trust your practitioner. So it's, again, this is why I wanted to have these conversations for like the younger people that haven't got there yet, but just to really make sure you're asking these questions.
Yeah.
And you know that the person that you're trusting on what the products they use and all of those.
Exactly.
So just as going back to kind of different like trending treatments, what is currently kind of trending out there treatment-wise that you would be like absolutely 100% recommend?
So I think really we're moving more and more towards the regenerative space, and within that is the longevity space. Now that does come with a caveat because we're at the beginning of that market, and so we don't have enough knowledge about lots of those areas yet to give a fully comprehensive longevity approach to patients. But that's where it's heading.
And there's a polynucleotide.
No, I'm thinking more, it's more internal actually. So making you biologically younger. So actually treating your cells within your body and age reversing.
Sign me up, him.
And actually, that's why one of the specialties of the new doctor that we've got arriving, who's going to help me with my maternity leave. But her passion is longevity. She's a medical doctor, and so she'll do all the full range of tests. And you can do a little prick, a blood test, and you can look at all the inflammation within your body, how biologically aged your cells are, all the different interventions. So you can focus your energies on, yes, it's the internal, but that all extends to the external as well. So you can start to do all these external treatments, but also become biologically younger and live longer. I mean,
that's the other thing, right? And that's where our but it's all well and good on the outside looking, but we also have to
horror show on the inside.
Hopefully not, but it's. I do think people are more, well, even like the wellness space. Right? I was speaking to somebody about this the other day and how our industry is booming so much. But it's because people are more invested now in spending more money on their bodies, as you say, internal and external. So it's great for us. But I think people just are more aware of...
Well, there's more ability to monitor. I've got my Whoop on, so I'm monitoring, and most people are monitoring their sleep, their strain, their this, their that. And now we've got all these methods in which we can, check hormone levels and aging of the cells, etc., etc. We can put these treatment plans, these internal treatment plans in place to be able to work alongside the external treatment plan. And it's really to increase the health span. So how healthy are you for how long?
And people are living longer now.
Yes.
So I don't actually just want to live longer and exist. And
yes.
We're going to live longer.
You want to be healthy. Yeah.
I was listening to a podcast recently and it was talking about, just high performing people and people like yourself, entrepreneurs that, we do have to be switched on.
Yes.
A lot, and energy wise. And now, bless you. I remember, it's hard.
It's a marathon.
That's also why I think people are more invested in just the general health nowadays, because for a long time, like in the 80s and whatnot, people were dropping down dead of heart attacks because of the stress levels.
Yeah.
Whether, we like it or not, we do engage in a lot more stress as a business owner. Maybe the hours are longer. It depends on where you're at in
in the cycle.
We spoke about. But I think people are, high performing people are starting to look at these things as well, and they're like, we still want to be on our game and not drop dead at the age of 50 because of stress. So I think it's amazing the direction that we are going in.
It's exciting. Yeah. I mean, if it excites you, it excites me. I can't wait for this doctor to arrive to be able to do my full analysis and come. Honestly, it's one of those really exciting developments within the aesthetic industry, and we are noticing, and even the brand representatives, for example, for the fillers and things, are noticing the trends that people are doing less fillers and people are doing more regenerative treatments, and that is both external and internal. So there is a shift. Fillers still have their place, a very important place, but they're one piece of a much bigger puzzle, and that's how they should be seen. So it's really, people are getting on board with that philosophy more and more now.
That's great. So we mentioned what you would recommend. What is out there on the market right now that you're like, absolutely not, we're not going to have that at Adventis? Is there anything that's kind of TikTok trending?
There's definitely a few treatments and things that I wouldn't necessarily recommend. I'm trying to think what would be my biggest. I think the biggest misconception at the moment is actually all around fillers and migration. It's a huge thing at the moment. Which isn't necessarily a treatment wouldn't do. But I do think that that's a little bit of a myth that is arising in the TikTok world. Filler doesn't magically suddenly decide to move. There are occasions when you place filler in a certain area, for example, the lips. That's the most common area of migration. But it's more to do with the fact that if you're adding a little bit too much volume, essentially you run out of space within the lip, and it's got to go somewhere. And there are little channels that connect the lip and outside the lip, and the filler can move through those channels. But it's not suddenly
it's not something over time, because they're kind of saying, in 5 years' time, your cheeks
just in your feet. then what happens?
Sorry. Actually, a friend of mine sent me something on Instagram the other day, and he's like, just in case you ever decide to get basically filler in your cheeks, and it was that exact story that it can migrate, and I'm like, have you seen my cheeks? I may need help everywhere else, but I have cheeks. I was like, don't worry,
non-issue.
It's gonna be fine. But it's true. It's just and he's like a very intelligent person. He looks at all this stuff, but all it takes is something to get out there. And all of a sudden people are like,
I get that question a few times a day now at the moment. And the other thing that I think is really important to understand about fillers is, let's say we did get something that had migrated, and really, honestly, the only area I've ever seen with that is the lip. I've never seen a cheek ever end up in a chin, ever. But let's suppose that it had moved to an undesirable location, or it was in an undesirable location for any reason. It is so easy to dissolve it. And I'm not saying we rely on we'll just put it in to dissolve it. It's not like that. But you don't need to dissolve the whole thing. You can use the tiniest little bit of dissolver and just gently massage it. Problem solved. So why are we making such a big deal? What are the consequences of this, and why are people worried so much?
Somebody, it's like propaganda. I mean, it's like someone in the industry is like, let's just badmouth this. We have a new one coming.
Why is it? It's got the outcome has got to be significantly negative for it to be that much of an issue, even if it does happen, which I've never seen it happen. So
that's just the world we're in right now. The social media influence is amazing. There's some things if you use it well, but it can also scare the life out of people. But we keep going back to the same thing. Then just make sure who you're trusting to put needles in your face or
And to
face
deal
off,
with the
make sure.
consequences if things don't go to plan.
Yes.
There is not one practitioner on this earth that can hold their hands up and say, I will never have an adverse event. I will never have anything go wrong. In the medical industry, no doctor can ever say that.
Yeah.
But are you going to be able to deal with any complications that arise? Do you know how to use something like Dissolver in that very specific way, to be able to not dissolve everything, but just to tweak it? So it's all these types of things. You think, yes, can they put it in, but can they deal with the afterwards as well?
Yeah, of course.
You know?
Okay, so then let's talk about what would be your top 3 things that you would recommend in like the climate that we live in. Because that's the other thing. You've also got to be very mindful that you can say do all these lasers and then the person goes to the beach the next day. So what would you say for men are your kind of top 3 treatments? I know, annual treatments. I know it depends on the age, but
It does, but there are a few general ones. I mean, look, Botox is always going to be the most bang for your buck you're ever going to get, the best results, the quick
fix. A lot of the
fix.
stuff is not.
Yeah.
You're kind of like, well, I do it, but I'm not really seeing the immediate result.
It's that gradual, and they still have their place, but honestly, nothing has ever, if someone's got some lines and wrinkles in areas where it's caused by muscle movement, nothing is going to fix it like Botox and give your client the happiest outcome. So most people, once they reach a certain age, can benefit from a little bit of Botox, most. So that would definitely be a universal topic. Skin would be the next one. I would say here, like you pointed out, we do have a lot of sun and we have a lot of sun damage. So that canvas upon which all these other treatments are built, if that isn't optimal and the health of that canvas isn't optimal, everything else will not look as good. And coming back to the point that most people want, everybody wants natural here. Everybody wants to look natural. But if your canvas isn't in the best health, doesn't matter if you put the most beautiful Botox fillers, this, that in there, it doesn't harmonize.
Right.
Because you've then got this quite damaged, creased skin.
But really big lips.
But really, yeah.
Shiny forehead.
Yeah. And then you think, well, why does that not look natural? So with aesthetics, it's not less is more, it's more is more.
This is why
Because, if somebody comes in and they just get a little bit of Botox and they continue just getting a little bit of Botox, as time goes on, there will be a mismatch between their upper face and their lower face and their skin quality and the balance of what's going on. So then why did that Botox look natural 10 years ago? I've done the same Botox and 10 years later it doesn't look natural.
Right.
Because you're not having that full face holistic approach. So the skin is really important. Doesn't have to be lasers, but it's got to be something. Whether it's medical grade skincare or things like microneedling, PRP, lasers, you've got to focus on the health of the skin. And Profilo, of course, Profilo.
That's another one I will say that I feel like the last 2 years everyone said Profilo and I'm like, I've been doing that for like 10
Yes,
years.
yes. It's old news for us.
You have been very innovative in this space because it's funny, even somebody else on Ireland the other day said to me, have you heard of this? This is the next big thing. And I was like, I've been doing that for 2 years.
Yeah, I've been there, done that. And actually, I was one of the first ever injectors of Profilo in the UK. And this must have been 10, 12 years ago.
Yeah, I've had some from as long as I've been. And that to me is like because I always say to you, I'm not like I was the person that's like, I don't want to look like I've had stuff done. Don't give me like, all of the things. I want it to look natural. And when you said about Profilo, and then the first time you get it, you're like, But now, when it's due, when it's like,
you're counting down the days.
And then I'm like, oh, that's what it is. I need my Profilo because all of a sudden your skin looks a little bit.
Yeah,
and
not as
really
hydrated.
do much, but it's hydrating, right?
Yeah, and actually there is a new Profilo coming up. Well, it's out called Structura. So that's like the next level up for slightly more mature skin. So that's kind of the next avenue where Profilo is moving always. And actually coming back to the picks, my third pick is thinking about something for the neck and chest area. Because no, I was not looking at you.
I know it's on the list.
I was not looking at you.
I know me and Senna spoke about
it's an area, and funny enough, hands. These are the types of areas.
I never thought about my hands.
Well,
I've got the sun. I'm like so pale right now.
The only thing you've got to be careful of here is driving. Yeah, I have my car UV tinted. It's not dark, but it's UV filtered, because otherwise you will notice the hands start to get pigmented, the texture starts to change, because you're right there on the wheel. So it's these other random areas that, if you're just focusing on face and not considering again other little areas, paws, knees, necks, chest, then again things aren't as harmonious as they might be.
So let's shift gears a little bit and let's talk about how it is working with your husband. You're business partners, and I love a business partner topic, and it's because I've had a few different business partner experiences, but you work with Johnny.
Yeah.
How's that going after 5 years?
Do you know what? No, he's just trying to get me out of the business. So that's what this is. He's sick of me. He wants a break.
How was the transition when you went into Aventis? Because before you both were working at different...
Well, funnily enough, when we first started White Swan, I started White Swan and brought him on board. It did not work. It did not work at all. First of all, he is obsessed with teeth, and then realised that actually he hated doing the aesthetics. So obviously, first of all,
he was doing aesthetics also.
he trained at the same time as me, because I loved it. And I was like, we're going to do this amazing business. And he was like, okay, well, I'll get on board. Did it. I was like, I hate this. I hate it. You can't do something like that you hate. And I was like, I love it. But we really struggled working together. We really struggled. But I'm so glad that we had that experience, because then when we came into Aventis, we carved out very individual roles for each other, both physically. So we have completely different corridors. It's like the building goes like this. I'm like, goodbye. And he sails off down his corridor. And if he ventures into mine, I'm like,
You're like,
get out of my corridor. But also in terms of actual roles, he's gone more of kind of the finance of the business. I've gone down more of the HR and the practice culture, and marketing aspects of the business. So we have separate roles. Obviously, he has the dental department that he runs, like the aesthetics department that I run, and that's worked amazingly. Wow. Not that we don't have our moments, but they're becoming very, very infrequent.
I think that's the key, though, whether it's your husband or whether it's a friend or whether it's somebody completely. It's from the onset having this is me, this is you, these are the boundaries. And obviously there's going to be times, especially maybe now with you going on maternity leave, that, what's that going to look like?
Yeah, how did the roles blend?
But it's just, I always say, having somebody that you can have that communication with, because there's times in business where it's not smooth sailing. And so it's very, very important from the onset.
And you have to have a united front. The team has to be guided by you as a force together. You can't be divided. You've got to have that. You've got to make an agreement together on how you're doing a particular thing. There can't be, well, I'll do it my way, he does it his way. It's got to be, we're doing it. This is the practice ethos. This is how we're moving. Yeah. Fingers crossed.
But no, it's but that's really good to know, because like, even again, I speak about within my businesses, I've learned so many things. We always talk about this. You have to go through those bad times to
100%.
and then going into the next one, hope that you don't make the same, repeat the same mistakes. But no, every time I've gone in there, it's funny that you say the corridors. I've never thought about it, but I'm like, hi, Johnny.
So, specifically designed like that for a reason. And it's worked. But really, that was a fear of mine going into this business, because White Swan was a very different beast. And in terms of how we did the investment, or how I did the investment once I'd shuffled Johnny out of the business, was I basically worked. So I had my day job and I worked in Guy's Hospital at the time.
Okay.
And I was getting paid peanuts at the hospital, but I loved it. And I was learning so much. And then every evening...
NHS, or is it
was NHS, yeah. And I would take my little wheelie suitcase after work, and I rented this little tiny space in this not very salubrious area of London. And I'd take my little suitcase and I would do my aesthetics in the evening, but I would just reinvest everything from that little bit of my income and put it straight back into the business. So, okay, we could afford like the next space, and we could afford a bit of marketing. And so it was very much, it grew like that. Whereas with Aventis, it was very different. There was a huge amount of investment that went into it. Very expensive laser, very expensive equipment. Everything was the best that we could possibly get. And so we had lots of loans with the business, huge financial implications. And therefore, there was no option but to make this work. And that was a fear of mine. We're coming into business together. We've invested every single penny we have in this business. What's going to happen if we don't get on? What's going to happen if it's World War III?
You have to make it work.
You have to make it work.
It's like that, no risk, no reward.
Yeah.
Right?
Yeah.
Have to.
You have to find a way to get on the same page. And we did have a business coach. We did, yeah, which was at my request, really. Because I'm always of the philosophy that know your weakness and plug it. And I knew, I'd never managed a team in that same capacity. I've looked after doctors, I've mentored doctors back home, but I've never managed a team or done the HR and the practice culture.
Especially here in Cayman, where it's so different to the UK.
So different.
People with work permits,
yeah,
health insurance, all of those things.
Everything. So different.
Calendars,
yeah.
So you don't miss all of this paperwork.
Yeah. And so, I knew that was a really big gap in my skill set. And so I worked with the business coach for 18 months. And it took 18 months to actually learn those skills of, you think, if I'm a nice person, I'm going to be able to run a team successfully.
You almost need to be, I hate to say it, I'm always the bad guy. And I always have to just accept that, because you cannot be the nice guy all the times, because if I was just a nice guy, I wouldn't have a business now.
Yeah.
None of them would have jobs. So
yeah.
Sometimes it takes that.
It's not about giving in. And actually, it doesn't make people happier. People don't want to just work in a team where the boss is just a yes man all the time or a yes woman. It doesn't translate to happy staff. And it's knowing how to navigate these difficult situations in the most diplomatic way, but then also making the harder decisions, but knowing that that will be best
interest of everybody.
In the interest of everyone in the long run.
Because employees don't always see that
they don't have the full
so
picture.
You have to communicate that.
Yeah.
And then oh my gosh, I wish that there's so much stuff I want to ask you on this part. We're going to do part 2. But there's, sometimes it's like knowing how much to share with the team.
Yep.
Because they need to somewhat understand why you're making decisions, or is it that you just have to have that approach of they need to just trust the decisions you're making? So it's always so I love that you had a business coach.
It was honestly so helpful. We would not have reached where we are now without having that business coach, because we had everything else figured out, but the team culture and the happiness of the team members was so crucially important to me, because that impacts on staff retention and it impacts on the feeling that people have when they walk in the clinic. When they come into our clinic now, everybody's laughing, everybody's happy. I like to work there, Johnny likes to work there, because it makes for a pleasant working environment. We don't have any bitchiness, and all of that
and clients pick up on
yes, if there's an atmosphere,
they do pick up on it.
They're going to feel it.
I know, because we're short of time, I don't want to keep you. I'm so glad that I got you before we went on maternity. But talking of expansion, because you told me you are expanding again.
Yeah. Not even. We're just in January coming up to our 3rd year, February coming up to our 3rd year. Yeah.
So you're expanding again?
Yeah, we're expanding
Can you share
again.
anything?
Yeah. So, I mean, we're expanding in terms of services. So we're bringing the oculoplastic surgeons in. So our big kind of mission for 2026 is the longevity space. Now that we've got Dr. Shahina, we're going to move into the kind of hormone longevity space. But we're also physically expanding as well, so that we've got more chairs, both for the dental and for the aesthetics. And then hopefully we'll expand the services even more. After
Amazing,
that.
because honestly, like, people don't realize how hard it is in Cayman to run a business. You know, it took me 12 years before I did the second location. So the fact that you're doing that to 3 years, like not second location, but expanding your
Yes.
footprint is amazing.
And it just means, we always want to be able to have the absolute best range of services that we can, and in the best way. We don't want it to feel overcrowded or tight in terms of appointments. We want the experience to remain the same. We want our beautiful recovery room to remain a recovery room where you've got a mask and a drink and the back door.
I love the back door.
Because we could easily, turn that into a treatment room, but then your standards are coming down. That 5-star experience that you're trying to deliver to patients that's always served us well, then starts to slip. Or, I'll just make my appointments 15 minutes shorter. No, non-negotiable. I would rather expand and have more space than compromise on the quality of the service that we're delivering.
I love that. Oh, I'm so excited for you
Oh,
guys.
thank you.
So then my last little wrap-up questions. How long are you planning on maternity leave?
Good question. So I'm planning on taking 3 months, but then coming back some afternoons. So I'm really glad that I'll have another doctor here to support, especially because she's staying on, so she's going to be a permanent fixture. But it just means that then I can come back a little bit more gradually. And like we talked about the other day, my whole life up until this point has been 100% focused on work and career and, that aspect. And so now, for the next 6 months or so, I can make sure that I focus on having a baby, still seeing my clients, still keeping my hand out. I'm still going to the ACE conference in March with a newborn.
Jason came to a conference today, I think he was like 6 months. And I was like, well, get used to it, kid.
Strap her in.
And honestly, like, it's, we spoke about it a bit briefly, but I just think, I said to you, like, I feel like you've done the perfect time. And they always say there's no perfect time to have a baby.
But there is a more perfect time,
And, with me, like, it's been amazing. It's because I got my business to the point where I actually could take a step back.
Yeah.
I know anything he has, any school, because these school things pop up all the time. It's like, we've got a culture day tomorrow.
Yeah.
Bake a cake.
Yeah. Or they need a fancy dress outfit.
So I think the beauty of it is once you've spent the years before building the business, now you are actually able to generally be able to take your foot off the gas and
have a little bit more freedom and
because you've done the work.
And I don't want, again, I want to put as much time and energy and focus on being the best mum I can be than I did to making the best business I can possibly make. So this is the next challenge. Doesn't mean I'm going to be AWOL from the business. Of course not. That's my first baby.
I used to, it's so funny, I took 6 months off and I would find myself, I'm just popping in. And I was like, because you miss it, right? And
of course you do. It's your identity.
But then you just take the baby along for the ride. So
I'm hoping I can navigate a good enough balance between the two, and give enough attention to both. We'll see. I'll talk to you again in 6 months. I'll let you know how it goes.
I mean, I'm year 9, so I'm like, well.
I'll come in like this at the next. It's all going well. Blink twice if you're okay.
They told me I can just give me a second.
Don't mind the baby.
Well, thank you.
Thank you for having me. It's been wonderful.
I could honestly speak for like 3 hours.
We could chat till the cows come home, couldn't we?
We need a part 2. I think once you have the baby, we should do like 6
we should.
To do it, because the industry's probably changed a lot.
Completely.
Anyway.
Yeah, I'll have all the 2026 updates by then. I would have been to the March conference.
Oh, yeah.
I'll have all the updates to give you.
Thank you.
Thanks so much.
But I want to do like that.
It was perfect. Thank you so much.